to the Minister for Health to discuss the situation regarding lung cancer in Ireland. Deputy O'Sullivan, you have a 4-minute introduction.
Thank you very much. And first of all, it is to acknowledge the progress that has been made in relation to 2 types of cancer, breast cancer and prostate cancer, because there's a 92% survival rate for prostate cancer, 83% for breast cancer and 63% for bowel cancer. But when it comes to lung cancer, the statistics are stark, a survival rate of 18%, and there are more killed by lung cancer rather than any other cancer. More have died from lung cancer than breast and colorectal cancer combined. It's the leading cause of cancer deaths in Ireland. Now, we look at the lung cancer mortality in Irish women. It's the 4th highest in Europe, more than 50% above the European average, and it's still increasing. Cancer has overtaken heart disease as the most common cause of death in Ireland as the population grows, and that translates into 1,865 deaths yearly. The incidence of lung cancer is expected to increase dramatically by 119% in the next 25 or so years. And there's also very significant statistics in relation to health inequalities in Ireland. Lung cancer rates are 60% higher in those socio-economically deprived groups than in the least deprived groups. Survival rates are also significant in the poorer socio-economic groups than in those that are better off. There also seems to be an urban-rural interesting statistic as well, that the urban are 36% higher for males and 38% higher for females in urban areas than in rural areas. So we're talking about over 2,500 new cases of lung cancer diagnosed per year. Now, we know the economic cost, but that's not taking into account the cost to individuals and to their families and their loved ones when a diagnosis proves to be fatal. Some other facts: lung cancer research gets lower levels of funding than other common cancers. And then the research is also showing that Ireland is falling behind other EU countries in relation to patients having timely access to the most innovative treatments. For example, 2 years ago in 2016, only 20% of new cancer medicines that had been launched in the 2 previous years were available in Ireland. And you compare that with 40% in Portugal, 76% in Germany. Lung cancer has the 4th highest percentage of emergency presentations, 25% of all. We know the association with smoking, but 20% of those with lung cancer will never have smoked. And when we look at the treatment, we know that early detection is vital, and treatment includes surgery, radiation, chemotherapy and cancer medicines. Now, there are new treatments, immuno-oncology, and research indicates its potential for improving the survival rates. Immuno-oncology medicines can be used as both first-line and second-line treatment, on their own or in combination with other treatments like chemotherapy. There have been developments in the biomarker testing which means that doctors can identify which lung cancer patients are likely to benefit from these new immuno-oncology treatments. Again, it's progress, and Ireland needs to be part of it for our lung cancer patients. At the moment, we're falling behind other EU countries in relation to timely access to the most innovative techniques. In fact, we're last among 13 West European countries when it comes to bringing new cancer medicines to patients. And when we think of the progress made in relation to breast cancer and prostate cancer, it is a shame. So the question is, what's the government planning to make sure that those with lung cancer in Ireland will have access to the innovative new treatments, including immunotherapy and combination therapies? These are the treatments that are making a difference to survival rates of those with lung cancer in the countries that are offering those treatments, and lung cancer patients in Ireland need the same and deserve the same.
I want to thank Deputy Maureen O'Sullivan for raising this particular issue, and I know that she's been a strong advocate for many, many years on this, particularly in relation to cancer in Ireland. And I welcome the opportunity to speak on lung cancer today. On average, 2,500 patients are diagnosed with lung cancer in Ireland annually, with 1,800 deaths each year attributed to this disease. However, much work has been done to address this. Survival rates for lung cancer are improving. In the last 2 decades, lung cancer 5-year survival rates have increased from 8% to 16% in males and from 9% to 21% in females. Prevention is a cornerstone of the National Cancer Strategy 2017 to 2026. It is estimated that the proportion of cancers attributed to lifestyle and environmental risks that can be modified is in the region of 30 to 40%. It is vital that we are effective in getting the message across to the population that each person can impact significantly on their level of risk in developing cancer. Effective health promotion and disease prevention initiatives result in less chronic disease. The Government has already initiated a policy to improve our nation's health through Healthy Ireland programme. The Healthy Ireland programme takes a whole of government and whole of society approach to improving health and well-being, with a focus on prevention. While at least 85% of lung cancers attributable to smoking, Tobacco Free Ireland, the National Tobacco Control Strategy, is an important initiative in reducing the incidence of lung cancer in Ireland. It is the key goal of making Ireland tobacco-free by 2025. There is evidence that past changes in behaviour in regard to smoking have led to better health for individuals, and this is something which can be built on to promote further behavioural change. Increasing the number of cancer diagnosed at an early stage is a key aspect of the cancer strategy. Cancers that are diagnosed at an earlier stage are generally more likely to lead to better treatment options and improved survival outcomes. In this respect, raising awareness in people that unusual or persistent symptoms need to be checked out is a critical step in the early stages in the early diagnosis of cancers. Recommendation 7 of the National Cancer Strategy states that the HSE National Cancer Control Programme, in partnership with the HSE's Health and Wellbeing Directors and voluntary sector, will develop a rolling programme of public awareness campaigns aimed at the early detection of specific cancers. Work is now progressing on the development of such a campaign for lung cancer. Rapid access clinics for patients with suspected lung cancer have been established in 8 designated cancer centres. These clinics seek to ensure that lung cancer is diagnosed and patients enter treatment as soon as possible. So far this year, Deputy, 87% of patients referred to these clinics have been seen within 10 days. With the ongoing implementation of the National Cancer Strategy, I look forward to increasingly successful prevention measures in regard to lung cancer, with early diagnosis and effective treatment leading to further improvements for patients. Thank you, Carla.
Maureen O'Sullivan.
Thank you for the answer. It's probably opportune that you're taking this yourself because of your own personal interest in this topic. We have to acknowledge the different rates for those with lung cancer, and I think that stigma is an issue, because while there's common denominators for all cancers, we know that lung cancer is predominantly linked with smoking, in spite of the fact that 20% of those with lung cancer have never smoked. But I think the stigma is also reflected in a survey which showed that 30% of those surveyed thought that non-smokers should have preferential treatment for lung cancer over smokers. So there's a question I have there, that is it stigma that is preventing people from presenting earlier, especially in the lower socio-economic areas. And I think it's very serious, because we know how vital early intervention is. I think lung cancer needs to figure more prominently in that Healthy Ireland strategy. Now, there will be a Cancer Patient Advisory Committee, and the interest in membership had to be in by the 19th of October. And I think it's very important that all cancers are represented there. And I'd hope that tackling stigma and early intervention will be part of the work of the committee. I had previously raised the issue of the heavy workload and the pressure on nursing staff in the oncology wards in our hospitals in Dublin, with nurses, some still in their training years, with no oncology treatment training, administering the medicines. We have a national cancer strategy, so how will they implement the steps to increase the number of lung cancer specialist nurses? We also need a patient advocacy group for lung cancer. In more of the I Am Lung Cancer campaigns, we know that Breast Check has been so effective. We also need a Lung Check campaign as well. The social inequalities associated with lung cancer, I think that's something for the committee that they could look at. So basically, it's looking at the cancer strategy, a checklist on the recommendations and on the timeline. Also really trying to take into account the facts on lung cancer, which indicate that it needs more attention rather and work. I mean, in your reply, you said 87% of patients referred to the clinics have been seen within 10 days, but we don't know what that 80% of, what that actually translates in numbers.
Well, thank Deputy Maureen O'Sullivan for raising these issues, and of course I take her point on I know I accept I'm very vulnerable on this particular issue as somebody who's addicted to nicotine. But I do acknowledge the point you make, and I will bring your views back to Minister Simon Harris. I totally acknowledge the points that you raised in the debate. Through initiatives under Healthy Ireland and Tobacco Free Ireland, it is hoped that we will see a reduction in smoking levels and a consequent decrease in the number of people diagnosed with lung cancer in Ireland. I am very committed to the implementation of the National Cancer 2017-2026, which was launched last year. We are focused on preventing cancer, we are focused on early diagnosis, the provision of quality treatment and the health and well-being of those living with and beyond cancer. Our efforts in recent years have led to significant improvements in survival. 5-year survival rates for lung cancer now stands at 16% in males and 21% in females, and I am confident these figures will continue to rise. Through the implementation of the National Cancer Strategy, I look forward to increasing successful prevention measures in regard to lung cancer with early detection and diagnosis, leading to further improvements for patients. But of course, in relation to the points you raised, Deputy, I will bring the points back to Minister Simon Harris as well. Thank you.
Very good.